Good day everyone. My name is Jorolan and I will be discussing the personality assessment method, the projective methods. So this is my topic outline, the projective methods, the ink blocks as projective stimuli and the pictures as projective stimuli. So, sa projective methods, may tinatawag tayong projective hypothesis. So, ano itong projective hypothesis? So, itong projective hypothesis, ito yung notion that when confronted with ambiguous or unstructured stimuli, yung response ng isang tao is nagre-reflect sa unconscious feelings, needs, anxieties, motives, thoughts, conflicts, and prior behavioral conditioning. So, ang example for this is yung sa TAT, like for example lang yung thematic perception test. So, yung picture doon sa TAT might cause one persons to make or to create a positive story about sa yun na image. While yung isang tao naman is makakreate siya ng negative story about sa same image. So that is the projective hypothesis. So projective techniques are indirect methods of personality assessment. So these are the projective techniques, the inkblot techniques, semantic perception test, and other projective tests, and under it is the Rorschach, the Holtz-Zaman. So, ang aking i-discuss lang po is the inkblot technique or the Rorschach, and the TAT, and other projective tests like sa hand test and so on. So, ang inkblot, yung Rorschach inkblots is created or developed by Hermann Rorschach in 1921. So first, he developed what he called the form interpretation test using yung inkblots as form to be interpreted. So he provided 28 case studies employing normal subjects and people with various psychiatric diagnoses, including na doon yung neurosis, psychosis, and manic depressive illness to illustrate his test. So si Rorschach, the Rorschach inkblot test was published in 1921. So there is a debate. There is a debate on how precisely classify Rorschach inkblots, whether it is better to be referred to as a test, a technique, or something else. So there has been also a debate na whether or not yung Rorschach is properly considered a projective instrument. So with all this controversy, the Rorschach remains virtually synonyms with the projective test among assessment professionals and is referred to as a test. So the inkblots, the Rorschach inkblot test consists of 10 bilateral symmetrical inkblots on separate cards. So half of which are achromatic. Yung achromatic is yung without color or black or white lang, black and white. Then 2 inkblots are black, white, and red, and then the remaining 3 are multicolored. So this is the example of inkblot, a Rorschach inkblot test. So the inkblot cards are initially presented in order from 1 to 10. So the test takers are asked to interpret kung ano yung nakikita nila sa inkblot and are provided a great deal of freedom. So after the entire set of inkblots has been administered, an inquiry is conducted, and the assessors attempt to determine what features of the inkblot played a role in formulating the test taker's percept. Next is the third component. A third component is the testing the limits. It may also be included in to enable the examiner to restructure the situations by asking specific questions concerning personality functioning. So the hypothesis concerning the what you call that, the personality functioning are formed on the basis of the variables such as content and location of the response and the time taken to respond, as well as many additional ones. So the Rorschach protocols are scored according sa several categories, including na doon yung location, determinants, content, popularity, and form. So, ang location, part siya sa inkblot, inkblot na na-utilize sa pag-form ng percept. So, individuals may use the entire inkblot. So, this a large section, a small section, and a minute detail or white spaces sa card. Ang determinants are ito yung mga qualities of the inkblot that determine what the individual perceives. Form, color, shading, or movement that the individual attributes to the inkblots are considered determinants. So the content is the content category of the response. Different scoring system vary in some of the categories scored. So some typical content area includes human figures, animal figures, anatomical parts, blood, clouds, x-rays, and sexual responses. So the next is popularity. So ang popularity is the response, ang yung popular response is one that has palaging ginagamit na ay palaging na-obtain from sa mga general population. So a rare response is one that has been perceived infrequently by the general population. The form of a response is how accurate the individual's perception matches or fits the corresponding part of the inkblot. Form level may be evaluated as being adequate or inadequate, as a good or poor. So patterns of response, recurring themes, and interrelationships among the different categories are all considered in the final description. So si John Ernest Axner Jr., he developed a comprehensive system for the administration, scoring, and interpretation of Rorschach test. Sa Exner system brought uniformity of Rorschach used. But despite such improvements, the psychometric properties of the tool are still debated. So ang test reliability sa Rorschach is a little value because of the very nature of the measurement. So ang inter-scorer reliability, it may be more appropriate. Next is pictures as projective stimuli. Yes, stimuli. So under sa pictures as projective stimuli is the TAT, or the thematic apperception test. So ang thematic apperception test is originally designed as aid to elicit fantasy material from patients in psychoanalysis. So ang nag-develop sa itong test is si Christiana Morgan and si Henry Murray in 1935. So there are 30 picture cards contained a variety of scenes that presented the test taker with a certain classical human situation. Some of the picture contain a lone individual, some contain a group of people, and some uh, cards contain no people. Some of the cards may appear to be almost as real as a photograph. So others are surrealistic drawings. Wait lang. So test takers are introduced to the examination with the cover story that is a test of imagination in which it is their task to tell what events led up to the scene in the picture, what happened at the moment, and what the outcomes will be. Some test takers are also asked to describe what the people depicted in the picture are thinking and feeling. So if the black card is administered, examinees are instructed to imagine that there is a picture on the card and then proceed to tell a story about it. So this is an example of the TAT test, the TAT. So, yeah. Since the administering clinician select cards that are believed to elicit responses pertinent to the objective of testing. So the material used in deriving conclusion includes the stories as they were told by the examinee, the clinician's note about the way or the manner in which the examinee responded, the clinician's note about extra test behavior, and verbalizations. So interpretive systems incorporate or are based on Henry Moray's concept of need, press, and thema. So itong need is, ito yung determinants of behavior na nag-arise from within the individual. Yung press naman is, ito yung determinant of behavior na arising from within the environment. And yung thema is, ito yung unit of interaction between needs and press. So those are the three concepts of Murray's: need, press, and thema. Next is the critics of thematic apperception test. So, yes, lack of standardization and administering scoring, interpretation procedure, test-taking responses may affect the situation factors and transient internal need states. Different TAT cards have different stimulus pools. So research suggests that the situation factors, including who the examiner is, how the test is administered, and the test taker experiences prior to and during the test administration, may affect the test responses. Additionally, ito nga sa second, transient internal needs states such as hunger, thirst, fatigue, and higher than ordinary levels of sexual tension can affect a test taker's responses. So different TAT cards have different stimulus pools. So that is according kay Morstan and Mathis in 1996. Yeah. So some pictures sa TAT are more likely than others to elicit stories with themes of despair, for example. So given that the pictures have different stimuli pools, or more technically stated different latent stimulus demands, it becomes difficult, if not impossible, to determine the inter-item or the card reliability sa ito na test. So, ang card 1 might be reliably elicit themes of need for achievement, whereas yung the rest na card, for example, 16 cards might not typically elicit any such themes. So, the possibility of widely variable story length is response sa mga cards na na-present, yet another challenge to the documentation of inter-item reliability. So those are the critics sa TAT. Next is the comparison of TAT-derived data and self-report-derived data. So si McClellan and others in 1989, they argued that self-report measures yielded self-attributed motives, whereas yung TAT naman, or the thematic perception test, yielded the implicit motives. So ano itong implicit motives? So it is the non-conscious influence sa behavior. Typically, na-acquire siya on the basis sa experience. Next. So, other tests using pictures as projective stimuli. So, here, meron tayong hand test. So, itong picture dito, that is an example of hand test. So, consists of 9 cards with pictures of hands on them and a 10th blank card. So, 9 with hand, and the 10th card is blank. Then the test taker is asked what the hand on each card might be doing. So when it is presented with a black card, the test takers is instructed to imagine a pair of hands on the card and then describe what they might be doing. So the test takers may make several responses to each card, and all responses are recorded. Yung responses are interpreted according sa 24 categories, such as yung affection, dependence, and aggression. Next test is the Rosenweg picture frustration study. So this test employs cartoon depicting frustrating situations. So the test takers is asked to fill in the responses of the cartoon figure being frustrated. So nakikita niyo naman dito sa example na may frustrating scenario. So here, if you fill in mo yung respond ng isang tao na nagiging frustrated. So test takers is asked to fill the response of the cartoon figure being frustrated. So the test, which is based on the assumption that the test taker will identify with the person being frustrated, is available in forms for children, adolescents, and adults. So young children respond orally to the pictures, whereas older test takers may respond either orally or in writing. So an inquiry period is suggested after administration of all the pictures in order to clarify their responses. So responses, yung responses ng test takers are scored in terms of their type of reaction na elicited and the direction of the aggression expressed. So there are intrapunitive, extrapunitive, impunitive. So those three are the responses express aggression. So ang intrapunitive is the aggression turned inward. Then the extrapunitive is the outward expressed. And impunitive is the aggression is evaded, so as to avoid or gloss over yung situation. So test takers' reactions are grouped into the following categories: the obstacle dominance, ego defense, and need persistence. So the direction of aggression may be intrapunitive. So yung sinabi ko kanina, yung intrapunitive is the aggression turned inward, extrapunitive outward expressed, and impunitive is the aggression is evaded so as to avoid the gloss over the situation. So reactions are grouped into categories such as obstacle dominance, in which the response concentrates on the frustrating barrier. Ego defense, in which attention is nakafocus on protecting the frustrated person. And the need persistence, in which attention is focused on solving the frustrating problem. So for each scoring category, the percentage of responses is calculated and compared to normative data. So a group of conformity rating, or the GCR, is derived representing the degree to which one's responses conform to or are typically of those of the standardization group. So this test has captured the imagination of researchers for decades, although questions remain concerning how reactions to cartoon depicting frustrating situations are related to real-life situations. So that is the Rosenberg picture frustrating study. Next is the apperceptive personality test. So consists of 8 stimulus cards that depict recognizable people in everyday setting, including males and females of different ages, as well as minority group members. So, in contrast sa TAP stimulus card, some of which depict fantastic or unreal types of scene. So another difference between APT and TAT is that yung emotional tone and draw of the stimulus card. So a long-standing criticism of TAT card has been their negative or gloomy tone, which may restrict the range of affect projected by a test taker. So after telling a story about each of the APT picture orally or in writing, yung mga test takers yung respond ng mga test takers to a series of multiple choice question. So in addition, the supplying of quantitative information, the questionnaire segment of the test was designed to fill in information gaps from stories that are too brief or cryptic to otherwise score. The responses are thus subjective to both clinical and actuarial interpretation and may in fact be scored and interpreted with computer software. So every picture tells a story. Well, hopefully for the sake of the clinician or researchers trying to collect data by means of a picture story projective test. So otherwise, it may be time to introduce another type of test, one where words themselves are used as projective stimulus. So that is the perceptive personality test. That's all. Thank you. Thank you for listening. God bless everyone.